Next we have Dr. Athira Pillai, and who will be talking on efficacy of cyclosporine eye drops, 0.05% versus 0.09% in dry eyes. Does the strength really matter?
Good afternoon to all. Our study is on efficacy of cyclosporine eye drop. That's two strength 0.5% versus 0.9% in dry eye disease. Does the strength really matters? As we know, the pathogenesis of dry eye, there is reduced tear film production and increased evaporation led to increased tear film hyperosmolarity and release of inflammatory mediators, which led on to surface epithelial damages, and there is reduction of mucin production, and this visual cycle continues to be happen. Then here comes the role of cyclosporine. It's an immunomodulatory agent. It causes the main action is downregulation of the interleukin 2 receptor, and it prevents its gene expression transcription. So it suppresses the cell mediated immune response. Aim of the study is to compare the two strength of cyclosporine 0.9% versus 0.5%. Materials and methodology. It's a retrospective study conducted in a tertiary eye institute during 6 months of period. Patients with moderate to severe dry eye were evaluated, and group A include 0.9% group and group B 0.05% of group. Then patients underwent dry eye evaluation including lipid interferometry, shimmer, TBUT and OSD scoring. Patients, those who completed 6 months of treatment were included in the study. After 6 months, again the OSD scores were calculated and analysis done, and p-value of less than 0.5% significant. This is the OSD questionnaire. Here mild, moderate and severe we can classify the patient. And this is a lipid interferometry. Here we can assess the average lipid layer thickness, and partial blinks were assessed. And here we can see the meibomian gland dropout areas and truncating of the glands. Thus we assess the patients. And the exclusion criteria: patients with the pre-existing ocular surface diseases, those who underwent ocular surgeries in last 6 months, patient treated with oral antibiotics like doxycycline and topical azithromycin eye drops were excluded from our study. Then moving to the result, age distribution is similar between two studies, that is most of them between 61 to 70 years of age group. Gender distribution also similar in A and B group. Meibomian gland loss, which is also similar between the two study group, A and B group, almost similar. Then coming to the OSD score, for group A, the pre-treatment OSD score is 30.1 plus or minus 7.3, which decreases to 20.3 plus or minus 9.2 post-treatment. In group B, the pre-treatment score is 28.2, decreases to 22.6 plus or minus 8.9 post-treatment. In both groups, we can see statistically significant improvement before and after the treatment. But the larger decrease in OSD score for group A, that 9.82 points compared to group B, that is 5.53 points, likely account for the significance term versus group interaction observed in ANOVA test. Then moving to the discussion, Rajpur and Metal study the efficacy of cyclosporine eye drops, two strengths 0.5% and 0.9%. There was significantly better improvement with 0.9%, similar to our study. Then Goldberg et al. Study the efficacy of 0.9% group. They saw significant improvement from the baseline, similar to our study. Then Burrard et al. Evaluated the efficacy of three strengths, 0.9%, 0.5% and 0.9%. During this study also 0.09% results are similar, better with the 0.9% group, similar to our study. Then to conclude, in terms of clinical improvement, there are higher percentage of patients with the group B. Group A, 81.8 showed improvement compared to group B, that is 69.1%. Although the difference between two are not statistically significant, it aligns with the trend observed in the OSD score reduction may be clinically relevant. That is, in conclusion, both groups show significant improvement in OSD score after treatment. The treatment applied to group A appears to offer a more pronounced benefit. These are my references. Thank you.
You have 2.05 and 0.09. What do you mean by that?
Two strength of cyclosporine.
No, what is actually there? How many grams or milligrams In how many ml?
Each ml contain 0.09%.
Each ml contains?
And
See,
9.
you are giving
9
0.05. You are telling what do you, at least you should know how many milligrams per ml or how many grams in per 100 ml you should know.
9 milligram in 1 ml.
You know, the clue is what? Multiply by 10. So many milligrams per ml. 0.09 multiplied by 10, how much?
0.9.
That's all. Understand now? 0.05 means 0.5 milligram per ml. Per ml.
Okay.
Okay, because you should know this when you are presenting a paper, and moreover you have given only, of course, initially you have got meibomian gland, that opening and all these things, pictures. You have shown from book. Your patient's improvement and all, whatever you have compared, no? Have you got any pictures? You have not shown any pictures.
Sir, that lip view picture is one of the patient.
You should.
Lip view, that
You have
picture.
shown?
That one picture, sir.
Okay.
This is the right, that.
This side. Okay, these were pictures. No, okay. Thank you.
In a study, the patient have any financial burden because this drug is very costly. I think.
Costly. And the test, all the tests are not repeated after 6 months.
Okay.
Only the OSD scores were calculated. So we cannot do all the tests.